I realize now. What? Wait, let's see. This works? Yeah. So now, actually, the introduction was, I was planning to say a few words about myself. Now I've already been introduced, so there's not much else to say maybe. So here, but what you see here is the campus of NHH. We also have one tall building from the late 60s, but not so tall as the buildings here in Rotterdam, and not so many. It's quite a compact campus. NHH is a full-fledged business school, quite large for Norwegian standards. We have most of the economics departments, business departments, finance, etc. And I'm head of the econ department at the moment, luckily just for 4 years. It's a lot of work with employment administration, but it's also quite fun. You can also affect the strategy of the department. So that is great. My research fields are health economics and pharmaceutical markets, which we will touch upon today. But in relation with the industrial organization, competition policy, which is sort of, which we will try to merge, as you will see a little bit in the lecture today. And I've also been chief economist in the competition authority, less health economics, more competition economics, competition policy. So that is merger control, antitrust, etc. I don't know if you have a question on that today, but let's see, you might have a question later for that. Let me also say that, I mean, moving from one crisis to another, suddenly Corona is less important, apparently, almost overnight. So I'll stick to the topic today, but it's really strange times. Now we had Corona had the headlines in the newspapers for 2 years, and suddenly they almost disappear overnight now, obviously, for obvious reasons. But this is sort of my plan for the talk today. So I'll start with a perspective, trying to bring us a little bit back to where we started for 2 years ago, and focus on a few key perspectives. Then I will move on to innovation of vaccines. I will ask the question. We observed that we got a vaccine for less than 1 year. So the question is how, or maybe you can add a wow to that. That is quite impressive. And I think it was quite surprising to many. And then I will move on to the procurement stage, the procurement of vaccines. I will focus a little bit on the EU policy. Was EU too keen on low prices, less concerned about supplies? I will try to address that question a little bit. And then moving further to the demand for vaccines, and focusing on why we were not reaching vaccination rates that were desirable. So focusing a little bit on vaccine hesitancy, which is a difficult word, but an important issue, I think. And then maybe the big question by the end, which I will leave as a question, but I'm happy to, I think we can discuss this for long, but I mean, clearly there was invasive methods involved with the COVID. All of you have been affected on that. I mean, maybe you managed to circumvent some of the curfew or restrictions on partying and things like that, but certainly it still affected you. So, I mean, there was quite some invasive methods for all of us. And the question that we can ask from an economic perspective is whether the cure was worse than the disease, right? And economists, you are good on trade-offs. I would say better than epidemiologists, but economists were not really, at least in Norway, invited into the policy design until very lately. So in the process, it was mainly governed by other disciplines. And I think economists really brought something to the table there. So that is sort of the agenda for the talk. So let me start by the perspective. Where did we come from? And then we are 2 years back. And what I remember was the pictures from the hospitals in northern Italy, more precisely Bergamo, which was the epicenter. You were seeing pictures like the one you see on the screen, overcrowded hospitals, lack of beds and doctors, lack of respirators, and even more problematic, people gasping for air, and many were dying. So that was sort of the initial the start of this. And clearly, if you look at the pictures, these numbers are taken from yesterday from Economist. So clearly, it's I think most people will agree that this is a very contagious and also deadly virus. Now it seems to be converging to more like a influenza-like epidemic, but over in the beginning it was quite different. So the official numbers, if you go to pages like Worldometer or something like that, you will see a number close to 6 million people have sort of the official number of deaths. But the Economist thinks that this is, and I certainly agree with that this number is underestimate. They have taken a different approach, and they say that the estimate is like more than three times higher. Is sort of what the point estimate is, and you see the confidence intervals here on the bar on the page here. And what they say is that, of course, there is a lot of measurement problems. There is that can pull in different directions, but obviously some governments misreport. Other countries that have better reporting, like the Netherlands, there is measurement issues like, do people die because of COVID, or do they die with COVID? That's a question. So that sort of pulls in the underestimation direction. But also many people die without being tested for COVID. So what the Economist does is essentially just to have a period of normal years within a region, and they have the number of the mortality rates there, and then they compare the mortality rates during the pandemic with that period, and then they have the difference as what they call excessive deaths, which they allocate to COVID. Irrespective of the numbers, I think people agree it's a contagious and deadly virus. And also, I mean, these policies, as I mentioned, these are the most invasive measures since Second World War. You have experienced it. It is full lockdown, influencing business and consumers and people, but also curfew, social distancing, homeschooling. So the obvious question is whether the cure is worse than disease, and economists ask this question and disagree also on that. So that was sort of the perspective I wanted to start with. Then I would like to move on to the innovation stage. Less than 1 year. Wow, that was impressive. So first I will just give a sort of standard introduction into innovation. I mean, there's a little bit, should be some topic to it. So I would say the obvious way to understand the dynamics of innovation is to start with the IO, industrial organization. I would say that you could set up a game sequence of decision stages. Here is at least one suggestion. You can disagree on or not on that, but I think you can imagine that in stage 1, you have the government announcing its vaccine policy, broadly speaking. At stage 2, pharmaceutical companies do their investments in R&D and capacity. At stage 3, they negotiate on prices and quantities. And stage 3 might happen also during as I will come back to, these negotiations. The procurement happens during the R&D, they are not waiting until the product is developed and on the market. They are negotiating before the product is approved for for use. And then by the end, individuals demand vaccines or not, which is what I will focus a little bit on. The point of showing this is essentially to stress that, backward induction. So when you solve this game, you would like to start at the stage 4 here and roll back to find the equilibrium, the optimal vaccine policy. And that just means that governments and companies are forward-looking, right? So when government design policy, they should think about how that will influence innovation, and then prices and quantities, and then by the end, the demand by consumers in the end. And companies, same way, investments, they will focus on their objective function, which is expected profits they can get from this. So this is, I think, how we should think about vaccine policy. So let me just say a few words about innovation incentives. So pharmaceutical firms are obviously private companies, they are big pharma, I think they fit well into the profit maximizing hypothesis. And given that, I mean, the incentive to innovate is related to the profit motive, right? So the more money they can make, the more incentives they have to invest in this, which might be good or not. So this is the only formula I have on the slides. So I'll just, I'll have this one, but that's all. So I was thinking about the sort of the expected profit of a pharmaceutical company in a very simplified way. And I tried to set it up like this. So there is a probability of success, which is theta. And if you have a successful discovery, then you can collect some income or profits. If you have no success, then obviously the income is zero, right? So the profit is obviously related to the probability of success there. Then the income is the global income, which you collect in all countries, where you can sell the product. So you have a sum of countries where you collect some profits from. And the prices that you can collect in these countries are individual to each country. So as I will come back to, EU was negotiating with the pharmaceutical companies the prices they could obtain in the countries, and obviously the returns here will depend on the prices they can achieve on the market. And I'll also come back to it very briefly. The CFO in Pfizer, he said that, okay, prices are too low now. We're going to increase the prices by several times, more than 10 times for these vaccines later. So there's some pandemic pricing, I said, during here. But then again, you have the final component is the R&D expenditure, this F, which I simplified to this F here, which obviously is related to the probability of success. So you would normally expect that the more you invest in R&D, the higher is the probability for success, the higher is the probability for collecting profits in various countries. So how do governmental policy fit into this? So if we agree on that this is a reasonable, simplified representation of a pharmaceutical company, how would this government policies fit into this formula? Yep.
So F covers both investment in R&D and also capacity, or is capacity now outside the story?
So capacity is a bit out, so I have simplified away capacity, but you could imagine this is also an investment decision, yeah. So now I focus on the innovation stage. I'll move on to the sort of the capacity question later, but yeah. So government policies are numerous, and there are sort of there's just not one policy for vaccines. So I mean there are many dimensions, and they try to affect these incentives of the pharmaceutical companies. So I just take a few examples of government policies. So the first, and I try to illustrate them sort of the channels they work with red, which is I label the direct effect, and green as the indirect effect. And the first policy, obviously, is the respect of patents, right? The approval of patents. So the approval of patents means that the company is protected from copying or for competition, right? Which means that it enables it to take a monopoly price. And that increases the profits from developing the product. So by respecting the patent, you can collect a profit, you can charge a price over marginal costs and get some rent. And why do you have the patent? Not because they can collect the profits, it's because this has an influence on the investment in R&D, right? So that incentivizes R&D. So it has an indirect effect on the F here, the investment in R&D, and then on the probability of discovery. So we get dynamic incentives into the model here. The next and quite important, as I will come to, I'll look at the US, how the US organized some of the government policies for stimulating innovation. The next one is R&D subsidies. And that is basically providing funds for spending money on research projects. And in a very simplified way, this directly affects the F. There is some cost sharing on the F. And again, indirectly on the probability of success here. Again, very overly simplified. But you see that this is a different channel, right, to affect innovation incentives. Then you have the procurement stage, which is also affecting the incentives, right? So the procurement phase, also the D should have been read here, but the procurement is about negotiations on prices and quantities, right? So how much do we commit to buy from the company? And that is also another channel to how you can sort of influence these innovation incentives. And finally, I have this reimbursement. How do consumers have to pay for the drug, or so for vaccines, they are free of use. This influences the demand, as you will see, and again, the profits of the company, but through a different channel, right? So and you have in play all these instruments, all these policies at the same time, and they are likely to, in aggregate, affect innovation incentives along different dimensions. Yeah. So then just have a simple graph here. So about the welfare gain of an innovation here. So very simply, you have seen these curves before. So you have a demand curve, and you have a marginal cost curve, and you have a consumer surplus, which is this triangle, right? We all agree on that. And then with the R&D, there is also an average cost curve here. So you have the fixed cost of innovation. So this means that the welfare gain from an innovation is essentially this area here, where you have the consumer surplus net of the R&D expenditures, right? As long as this is positive, you have a welfare improving innovations, right? Which is worth spending money on. And clearly, if the optimal incentive, if you want to give optimal incentive, so that sort of again, overly simplified, then you allow the innovating firm to extract all consumer surplus, the whole gross welfare gain from the innovation, and then cover its R&D expenditures through that. But we know from practice that this requires third-degree price discrimination, which is not very feasible, charging different consumer groups different prices. And in practice, this is not very feasible. But that would have sort of been like a sort of a first best solution to stimulating innovation. So the alternative is to have perfect competition here. So if you think about, so now I'm going to talk about perfect competition and then monopoly as two market outcomes. So if you look at perfect competition, what is the problem with that? Well, essentially the problem is that you have prices equal to marginal costs. We agree on that. right? So R&D cost expenditures are sunk. This means that you don't cover, so the innovating firm will not cover its fixed costs. So if it is perfect competition in the sense that it's free entry to copy the innovation, and this is costless, more or less, you can just re-engineer sort of the innovation. Then essentially firms can enter, charge lower prices without sunking the R&D costs, and this innovating firm has no incentives to innovate in the first place. So innovation will, so there will be underinvestments or no innovation at all in such a setting. So that is sort of where patents come in. So essentially, what patents allow for is that you have monopoly pricing. Prices, the company is protected from copying the formula. They can charge monopoly price. They get this patent grant, which is essentially the price difference between the average total cost and the price they can charge. This is the patent grant. And if this is sufficiently large, or the larger this is, the more likely they are to innovate. But once you have the monopoly case, you have this trade-off, you know, from economics. You have a deadweight loss. This is the deadweight loss, is this triangular here. So so now the prices are so high, so consumers have a lot of consumers with willingness to pay that are higher than marginal cost. So there is really a trade-off. So there's been a lot of suggestions of how to refine the patent system to minimize this static inefficiency here. But let's get back to COVID. So how is this relevant to COVID? So patent was relevant to COVID. There was this waiver. So India and South Africa, which both countries have a significant capacity on manufacturing drugs. They both took an initiative to speed up, to have a waiver, which is basically share the formula with these generic producers, and then allow for a fast so the advantage is, of course, then you get a lot of more capacity, right? And then also you can speed up the distribution in middle and low income countries. This was surprisingly backed by the US government and also a lot of organizations. They emphasize that there's a race between vaccination rates and new virus variants. So it's important to speed up, also benevolent for US. It's also beneficial for US to speed this up. However, Europe, UK, Japan was not too keen on this. And also not big pharma, they would refuse this. And then you have they argue for doing this in a different way. They also argue that this regulation, the TRIPS agreement, which regulates the patent rights, were too complicated to have this waiver. It would just be a mess. So it ended with no waiver, and instead more money through the COVAX program for low-income countries. So yeah, so this picture shows like an example of the innovation process, the stages in an innovation process, which goes from basic research to diffusion, and essentially where does government subsidies comes in here? So it comes in mainly through obviously to universities like Erasmus. There is basic funding to universities. There is direct research programs to universities, biotech companies, and there are public-private partnership programs during here. So what is interesting is to see again this success of the innovation of COVID-19 vaccines, which made me think about a a movie I've had seen, quite a bad movie I've seen not so long ago. But it was, I think this was like a new world record in terms of speed. Less than a year since the outbreak, you had two quite very effective vaccines on the market from a technology that was not expected to be the winning technology, ex ante. So the mRNA was thought about as more experimental, less chances for being successful. It ended up with being the most successful vaccine. So I have a few slides on the US program for how they subsidized R&D. And this was, so Trump did a lot of strange things so it took, I mean, we all know from the media what he said about the virus and about vaccination and all this stuff. But one thing that has gone more under the radar is this program that they call Operation Warp Speed, which is basically an R&D subsidy program, a partnership program with the biotech industry and pharma industry in the US. So this was a federal effort by the Department of Health and Human Services and Defense that allocated money to their to basically to two entities, again, two governmental entities, the National Institute of Health, NIH, and also BARDA, which is the biotech regulatory body that is sort of also funding biotech research programs. And the aim was basically to accelerate twofold. So it's sort of aimed at accelerating the development of the vaccine by giving subsidies. And the other one was to secure production capacity. So it's sort of aimed at both. So they wanted to stimulate R&D. They also wanted to ensure that the manufacturers like Pfizer were committing to building capacity to producing the vaccines once they were developed. So they had these twofold complementary things in mind when they designed this. And interestingly, I think they both sort of, this is how they designed it, broadly speaking. So they allocated a lot of money, more than 10 billion. Later it is US dollars. It escalated more during the process, during the pandemic. But what they did was the design was essentially like this. They chose three platforms, three technologies. So they had the mRNA technology, which is the one you see to the left. Then you have the protein technology to the right, and then in the middle you have this viral vector technology in the middle here. And for each technology, they chose not one winner, but they chose one receiver, but they choose two receivers. So they had competition across platforms and within platforms across firms. So this was sort of the way they set it up. And you see here you have Moderna and Pfizer for this mRNA, Janssen and AstraZeneca for this other one, and Sanofi and Novavax for the third technology here. And also interestingly, this is a US program, but they give money to also European companies here, right? So they don't prioritize not just their own companies. So they select apparently companies that they believe could be successful in developing these vaccines. Sort of, maybe they have some slightly bias towards US, but not exclusively to US. And the next table here that shows this is from a paper by Philippe Guillaume, who sort of collected these numbers and put them together in a table. And I just took out the ones that I was sort of the table is a little bit longer in the paper, but here you recognize the companies again, and you see you have the European subsidies to the to the very right here, the EIB, that's the European subsidies to these vaccines. And you have the American ones, the BARDA award in the middle here. And you see there's really difference in the sums of money they put into the R&D subsidies programs. So you see that there is enormous amount, quite big differences, both in what they select and also in the sums. And we know all these are, maybe with one exception, all these are coming up. Well, actually, all these are on the market now, right? So more or less, or on the way on the market right now. So it's with more and less success. So obviously, yeah. So are there some lessons for Europe here? So, I mean, Europe is strong in pharma. I mean, if you look at the UK and Switzerland, if you include that, and you have Germany and France, so there's long traditions. Europe is strong, also university side. But apparently they are quite weak on coordination here, right? So this program in the US was a federal effort. In Europe, there was sort of, many people would say there was lack on coordination of stimulating this. Decentralized budgets, long processes, no coordination across budgets or member states. And some people claim that there's a need for a renewed innovation policy. The potential is there, but the performance was quite poor, as some people say. Right, so then I move on to the procurement part, moving on from the innovation stage, and asked the question, was Europe too focused on prices? So here, in contrast to the US, here, on the procurement side, the Commission took leadership, right? So even Norway was sort of joined. So even Norway, not being a member state, joined these negotiations with the pharma companies on securing vaccines and negotiating on prices. So Norway, a bit humiliating. We had to ask Sweden to negotiate on our behalf. That was not first best, but it turned out well. We got some doses from Sweden, very slow in the beginning. I guess that was also the case in the Netherlands and other countries. But the EU took leadership, and they used what they called advanced procurement agreements. Sometimes it's called advanced market commitments. The idea is essentially that you negotiate before the drug is on the market, right? And you commit to buying certain quantities of the doses before it's really produced. And also you negotiate the prices you pay per dose, or more sophisticated, a price schedule that you will pay for these drugs. And this is become quite common, and this is also a way to subsidize or reduce risk for the innovating firms. So the innovating firms know that they are insured a certain quantity at a given price if they are successful in bringing this to the market. So my question is, as I said a couple of times, was EU too concerned with getting a good price, jeopardizing the supplies? So let me just say a few words on this. So by accident, the prices of the original contract leaked out to media from this procurement contract, and you see there was really some price difference. AstraZeneca had a super low deal. Maybe that's related also to the not being so efficient in protecting it, but apparently Moderna had got a better deal here. But there was also a price schedule. So if the efficacy of the drugs become higher through studies, then they could charge a higher price also. So Pfizer, I think Pfizer got upgraded its price. So there was this price schedule depending on the efficacy of the drug in the contract. Interestingly, this was sort of a statement by the chief financial officer in Pfizer to media. I don't think the timing was very good, but what he said that Pfizer is now charging the US $19.5 per dose, which is not a normal price like we typically get for a vaccine. He expected to be like 150 and 175 per dose. So this is pandemic pricing. So this is really where they sort of were expecting to get after these prices. But anyhow, was EU too keen on low prices? Well, first observation I will present is that is Israel essentially, or these curves. This shows the share of the population that is fully vaccinated against COVID. It was now up till quite recently, and you see the speed of vaccination is really lagging behind in EU. So EU is really lagging behind compared to, here we have United Kingdom, Israel, and the United States. So Israel was not involved in any production. They didn't have any companies producing this themselves. They just paid a very high price for. They paid several times the dose price that EU got, and they got priority, right, from Pfizer. They also shared the data from how vaccine performed in the population with Pfizer, so that also probably helped. But interestingly, EU is lagging behind here, right? So so that's the first observation. The second observation is something that you might have read on. In the newspaper, there was this conflict between AstraZeneca and the European Commission. So AstraZeneca had in the contract promised to deliver certain quantities. They claimed there were delivery problems. But then the Commission, I think they discovered that in some storage in Italy, there was a lot of AstraZeneca doses that were going elsewhere in the world to places that were paying higher prices. So obviously, when you sort of negotiate very hard on prices, the companies want to sell more, try to bypass this to some extent, try to prioritize where they get higher money. And this was a formal litigation taken for Brussels court, but it resolved with an agreement between the Commission and AstraZeneca. But then shortly after, AstraZeneca was dumped by the Commission as due to for health reasons. So that was sort of two anecdotal observations that suggest that the European Commission was maybe too keen on low prices, not so keen on getting the vaccines rapidly. And clearly this has large implications. I mean, if the vaccination rates are really low, this means that you have to be facing non-medical restrictions like social distancing for a longer period, lockdown for a longer period, maybe curfew for a longer period, etc. So I think speed is also something that has to be, the delivery is also something that has to be taken into account when you go into these these procurement contracts. And then I sneaked in a small advertisement in the presentation. This is an advertisement of my own paper. We have a paper on how to pay for pharmaceuticals, where you. So now the contracts are usually specified in a way that they pay a price per unit, which is called, this is uniform pricing. But an alternative is to have a two-part tariff, right? So it's like this has been suggested. So this is not something that we come up with. The Netflix method for paying for pharmaceuticals is something that has been discussed. So we have a paper on this alternative way to design the procurement contracts for a health plan. So I will not advertise more for it, but I would just say that Yeah, we just say that you might Google this if you're interested. I think this is quite an interesting path. I think there is scope for improving the design of the procurement contracts for health authorities. Very good. No more advertisements. So then going back to moving on to the demand for vaccines. And again, a little bit textbook stuff. So you have this diagram here. And you know that the individual demand for a vaccine can be this, or the willingness to pay for vaccine is can be something like this. You have a marginal cost, and if you have a free market competition, you will get this quantity of vaccines demanded. However, there's a positive externality of vaccination, right? So if I vaccinate, I'm less contagious, I'm less likely to infect you. So there's a positive externality, which means that the social benefit of vaccination is higher than the individual benefit of vaccination, which is the rationale for that you want to subsidize vaccines, right? So now we get vaccines for free, which is a subsidy, right? So that is how it is. So this is where we are. That doesn't mean that we are at the social optimal level, right? But we are closer to the social optimal level of optimal vaccine rates, right? By giving the vaccines for free. But what has been, I think, has been interesting with the COVID, which I think is a more general thing, is that subsidies of vaccines is not sufficient, right? To achieve optimal vaccination rate. They bring you a part of the way, but not all the way, right? So it's one thing that has been raised is this vaccine hesitancy, that the share of the population has a legitimate or illegitimate fear of taking the vaccine, right? So this means that essentially the willingness to pay for a vaccine is zero, right? So you would rather pay to avoid the vaccine, you could say. So this means that you can subsidize, but I mean, you can only reach a certain vaccine. So if this share of population is sufficiently large, and I think it's a particular concern that new vaccines, that people are not aware of all the side effects, long-term effects, less people might be willing to take the vaccine. So how should you design the government policy in that situation? Is it a rationale for fines? Is it a rationale for more invasive methods? And clearly we have examples that governments made use of more invasive methods to not just, so they use both the carrot by subsidizing, but also the stick by introducing the corona passes, by using negative tests for different activities like traveling or going to concerts, etc. So if you look at this picture here, this shows the development of vaccination rates in Europe, and I think this is a very interesting picture. It shows that most of countries have a similar pattern in the beginning of the period here, right? And then by the end of this period, you see a huge differentiation here. So Bulgaria on the bottom here has only reached like, this is the share of people who have received at least one dose. They have, yeah, I don't see exactly, but 30%, something like that, has one dose here. Whereas you have Portugal on the top with almost the whole population having one dose now. So, you cannot claim that this is due to vaccination hesitancy, but it can be one potential argument that you would never reach. So herd immunity for COVID-19 was first thought about being like 70% of the population had to be vaccinated, but this is not an exact number. Maybe it's even higher with the Omicron. So it's like maybe 90%. But clearly, most of the countries here are below this level, right? So how can you? So you're offering the drugs for free, the vaccination for free. How can you push the vaccination rates even further, right? One question there. So you had the invasive methods, like the penalties, the stick to vaccination. And I think it's interesting to see how this might develop. So in a country like Bulgaria, there might be, so where does the hesitancy come from? It can be distrust, it can be lack of information, it can be just some risk aversion. But one interesting thing is to see what happened in France. So here you have a graph showing the share of, this is based on quite a large survey, and it's dividing people into unvaccinated and not willing to get vaccinated. That is the red bar on the top. And one interesting thing is to see that this share is decreasing, right? So the interpretation here is that as more and more people as the pandemic were going, there came more information that the vaccines were safe. There come also more, maybe also people know, like I have some colleagues taking the vaccines, etc. And you also get more systematic information about the vaccines. So there's sort of lower share during the process of hesitant people, so you can reach higher vaccination rates potentially. And also, again from France, this about corona passes, using the stick to induce people to take vaccines. There was this speech by Macron in 12th of July on French TV, where he sort of set up the timetable for mandatory vaccination for health workers, corona passes for restaurants, cinemas, etc. And also stated a clear goal of 75% of the population being vaccinated by September. And you see, after this speech, there was like a rebound of the vaccine share of the vaccination of the first dose. So this is something that I think is interesting information. There's also papers doing like more econometric approaches, difference approaches to estimating the effect of some of these methods like corona passes, finding effects of this. So the final thing I was final question I was asking is, is the cure worse than the disease? And here I think there are strong opinions on many sides. I just wanted to show two pictures. The first one is this graph from The Economist. This shows the weekly GDP for 46 middle and high income countries compared to the pre-pandemic trend. And they find that by now, recently, it's only 2.5% below the pre-pandemic trend. You see that, of course, there was a large dip in the beginning when there was a full lockdown. Then economies seem to recover. And this is this a large or a small number? Hard to say. It is an impact apparently, but not enormous maybe on the. But that's just not one number. I mean, this is of course there are inflation rates were increasing, but maybe economy will recover quickly after the pandemic. The other picture I will show before I sort of conclude is Norway and Sweden, since I'm from Norway, and And I think this is an interesting example of two neighboring countries with very similar population, with very similar geographical distribution of population, with very similar healthcare systems and other things. Norway is slightly better in skiing than Sweden, but that is, of course, in the number of medals. Talking about Olympics, this is always important. But very similar countries, very different policies, and also very different outcomes when it comes to the sort of this effects on in this measure. It's the effects on excessive deaths from the Economist again, both official numbers and also the estimated excessive deaths in the two countries. So here, obviously, policy matters along many dimensions. I haven't seen any systematic study on how whether Sweden basically managed to recover better economy-wise. I don't think there has been some preliminary studies on finding no difference in GDP, but of course there's a complicated econometric problem to isolate the effect of COVID on COVID policy itself. But we would of course always like to beat Sweden also on these dimensions. Very good. So that was basically my talk. So I was sort of having these 4 points. Innovation, what explains the new record in development. I think EU can learn from the EU, how the US designed the government subsidies, this Operation Warp Speed. I think there's many lessons to learn there. On the procurement, maybe EU was too keen on low prices, too little concerned about the supplies. Now vaccination rates are sort of converging to the same levels, but we suffered maybe for a longer period. At least in Norway, it took a long time before we could get the first dose and also the second dose. And vaccination, there's more to vaccination than just subsidies, right? So it's really a fuller picture of understanding. So people might be interested in behavioral economics. I think that can speak to this. And I think there's a lot of interesting empirical things to be done on the psychological side, the behavioral side on vaccination, and also many lessons to be learned for governments. And I think the last question is pending, has the cure been worse than disease? I think that really, I think many economists might think that's the case. But I think we will see, and also there's more work to be done. So yeah, that was what I was planning to say, and yeah, happy for comments and questions.
How does this pandemic pricing fit into the concept that these pharmaceutical companies are pure profit maximizers? Because they said they price lower than they do all the time. So isn't it the cost of being profit maximizers? So how do you resolve it?
Yeah, it's a very good question. I was thinking exactly the same when I was reading this quote. So do you have any thoughts yourself about that?
Maybe because they care about shareholder wealth rather than just pure their own profit, and their shareholders also have stake in society. So because this impacts society, structure that dominates profit market.
That's a good answer. So they are to some extent thinking more long term than just collecting the short term profits, right? I was also a bit puzzled on that statement, especially going out broadly with it. So I don't know if it was more like they wanted to anchor the pricing level for later. So maybe sort of wanted to signal to, because I mean, they don't do this by accident, right? He doesn't go out saying this by accident. I mean, Pfizer is a big company. so you don't say whatever you like as a chief financial officer. So maybe this was more anchoring the prices in when demand is less extreme, right? But yeah, I think you're good.
Thank you for your speech, for the talk. I've got actually 2 questions, maybe 3, sorry. The warp speed, I was thinking that it maybe also had something to do with the approval process, right?
With them.
The approval process, how things are tested, that it doesn't move from one stage of testing of a new medicine, it's extensively tested in many different stages. And now they did some of those stages more or less simultaneously. I was wondering whether that is maybe also applicable to maybe in general testing of medication. Should we want that or not? Do you have thoughts on that? I have a question also on the advanced procurement contracts, because at first sight, but I'm an in there, it seemed as if they did try to guarantee some speed there, right? There were some delivery times there as well.
Yeah. So
in what sense was it the focus on price? In what sense was it maybe a lack of focus on the clauses governing breach of contract, for instance? And was this avoidable if we had better contracts, or was this unavoidable because the prices were just too low and he would have breached it anyhow? There's maybe some option type of consideration there. Yeah, so let's do those 2 questions.
Yeah.
Good luck to you.
So on the speed, Operation Warp Speed, my understanding was this was mainly R&D subsidies, but the FDA obviously allowed for fast tracks for many of these vaccines. So should we allow generally fast tracks? I'm not sure. I mean, I think this is a pandemic. It was very urgent. I think it's reasonable done, but generally a fast track for approvals of medicines doesn't seem to be a very wise strategy, I would say, given that the side effects, you would like the drugs to be tested on a representative sample of population before you sort of approve them for a broad population, I would say. So there need to be particular reasons. I don't know if that was to your question, but on the question of whether it was, so there were like quantities agreed on certain dates in the AstraZeneca contract and on the other contracts. They were supposed to deliver X doses within January, that date, etc. And of course, if you had, so they brought AstraZeneca to court, right? They tried to enforce this clause. So I don't know if it was anything wrong with the clause itself. It was just the incentives of AstraZeneca to circumvent the delivery to EU, right? So of course, yeah. But of course, if it was more strict or maybe more penalties involved with not delivering this, they could disincentivize it. Yeah, but the contracts are usually mainly secret, so it's not really possible to see all the details. But, yeah.
So I'm wondering whether basically you get stuck with that if the medicine is very good, the vaccine, and there's a lot of demand around the world, they will reach it anyhow.
Yeah.
And you get stuck with the medication when demand is low because there are better vaccines out of there. I was wondering whether there are mechanisms like that also.
Sure. So I mean, if so, that was what I was actually what I was thinking. That I mean, as long as there's another country paying, say, like Israel paying 3 or 4 or 5 times the price that the EU did, then you could possibly use that some of that profit to pay for the delay in Europe, right? So it's profitable to breach it. So you need penalties then in the contract, I guess, for breaching it. Yeah.
I had a question regarding the situation between Norway and Sweden, because you showed, of course, the graphs of the death toll during the pandemic of these two countries, and there's a very big difference. And I was wondering if there maybe was also a very big difference in terms of economic damage that the pandemic or the specific rules might have caused in these two countries.
Yeah, so that was what I was sort of quickly mentioning by the end, that there are some studies on the effect on GDP, for instance, in the two countries. But these studies are quite preliminary, and it's also always hard econometrically to identify the difference. I mean, you have to have some benchmark, and if you just do pre-post comparison, it's not really easy. But these studies show no really significant differences in Norway in the development in GDP compared to the pre-pandemic pattern. But the argument in Sweden was, of course, that okay, restaurants could keep open, concerts could be held, cinemas were running, but if you look at the figures, it doesn't seem to be really any big difference there. Yeah.
Yeah, you had mentioned in the beginning that the discussions or the decisions were more influenced by experts in science than it was by economists. Yeah. You said that was the case in Norway, and I think in Europe, at least where I'm from, this was also the case. How come, in your opinion, that the EU didn't lift the patent restriction kind of law like the US did, if it was currently about the health of the people?
Yeah, so okay, so the patent, that's I don't think so. In Norway there were this there was sat down an economic advisory group to the government quite late, and this advisory group were really influential in how the vaccines were distributed across the country and across populations. They said that okay, what the epidemiologists have sort of recommended was a bad idea. So they were basically arguing for an equal distribution of the medicines or the vaccines across municipalities, whereas this economic committee came in and said, okay, this is not really how you should do it. You should distribute to areas where the pandemic is much higher. You should reallocate the distribution. So in that sense, they had an influence. On the patent side, were never a topic in Norway, at least, because that's clearly an international question. The low-income countries, the Africa, sub-Saharan countries, and Norway was really involved in the COVAX program and was pushing through the COVAX program there. And I think it would be very difficult actually to violate these patents. I think there was these arguments that the TRIPS agreement was very difficult because you have the compulsory licensing path that you should use. I think it was actually quite. It's hard to say, but targeting money through COVAX, sponsoring vaccines through COVAX was probably an easier path to go and more effective path to go, than widening the patents. But yeah.
I think we can try to take one question also from the online audience, if there were any.
It was asked by Arjan Anon, why do we need patents if the development of the drugs is highly subsidized?
Why do we need patents when it's highly subsidized? I think these are complementary I think it's a good question, but I think these are complementary instruments, right? So you can as I try to say, they affect innovation through different channels. The patents affect it directly on the income side, in the sense that you can take higher prices. R&D subsidies goes through the cost side by sponsoring the investments in research. So, and I think an important issue, I think, is that the development of a vaccine, which is, I mean, this is just an idea, this is a good idea. That's a global public good, right? Everybody enjoys the value of this global invention. So if you just subsidize the R&D expenses by government budgets, you just subsidize the cost side, and you don't necessarily. And if it's just one country or two countries that does this, then this contribution to the public good as a new vaccine is isolated to the countries that actually spend the money on subsidizing R&D, whereas everybody should contribute to paying for the vaccines as they are enjoying the benefits of it. So that's, I think, is. Yeah.
Okay, I think let's give another round of applause to one of our.
Just want to say, if you want to contact me, here's my email, and if you want to come to Bergen to NHH, here's a picture of the school and of the city. So you're most welcome. On a nice day, it can rain in Bergen, but very sunny. Okay. Thank you.
Before we go outside to have wonderful drinks sponsored by the Erasmus School of Economics, just a couple of announcements. First, if you had not yet received a goodie bag because you came later or didn't pick one up at check-in, we'll be handing them out right after this. So just come down here and we'll be able to give them out. As we said earlier, the announcements for what your score was for your team and also the winners of the competition will be announced later this weekend due to some complications with grading. If you want your booklet back, or if you never got a booklet because you participated online, please come and we will be handing them out partway through the drinks outside. So there'll be a table set up in the corner where you're going to be able to get that. Yeah, and besides that, thank you guys so much for coming. One quick final announcement, I was told.
Thanks a lot. So I'm Dirk Schindler. Two disclaimers. I know that I'm the one standing between you and the drink, so it won't last long. Second disclaimer, obviously I'm improperly dressed for this event. I just learned in short notice I'm taking the stage, and effectively you don't see me here. I'm just a ghost and avatar for Robert Dürr, who cannot be here with us today and who could not address you via the live stream either. And Robert wants to send some words of thanks. First, thanks again to Kurt for a great lecture. Kurt, tusen takk for en fantastic listening. Second, Robert believes, and I fully agree, that the academic committee of Eclipse did a wonderful, fantastic job in setting this Olympiad together. And let me be precise, the members were Jona Bohl as the chairman, Leonard Jacobs, Nikolai Langveld, there, Noah Agami, yeah, and, well, sorry for mispronouncing, Shruti Ramesh. Okay, so I believe, and Robert believes, we all should, well, on behalf of Robert, on behalf of the Royal Dutch Economic Association, on behalf, well, also of me and on behalf of all of you and us, we should give the academic committee a big hand and a big applause. I think also a big thank you to Robert, who couldn't earn the fruits that he actually were well, he couldn't earn the harvest that he was seeing. So,
thank you so much. And with that, it's time to drinks. Also, can the team CRN from the Olympiad come down? We just have a couple questions about your answers. Besides that, please let's go outside and have drinks.